Skin rash relief. Can all rashes be cured?
All rashes cannot be cured. Some rashes that are a result of a cause that we can identify, if we can eliminate that cause, whether it's an allergen or a medication, we can often get rid of that rash. Sometimes a rash is caused by an internal disease that needs to be addressed. And if that internal disease is curable, then the rash can be resolved. But if the internal disease is not curable, the rash cannot be resolved, may be able to be controlled, but the rash may allow your doctor to make the diagnosis. And some rashes are chronic. You'll have them forever. There is no cure. That's difficult for some patients to accept. If you have atopic dermatitis, for example, which is a chronic disease of the skin, there's no cure. Psoriasis, there's no cure. But your dermatologist has medications that can help you control the symptoms associated with these conditions that may make the disease less visible and with fewer symptoms.
What's a common mistake people make trying to treat a rash?
Some patients come in with itches and they assume that it's a fungus, and they will immediately try an over-the-counter antifungal cream. A lot of times what you have on your body is not a fungus, and using antifungal cream won't make your rash worse, but it may not improve it at all. At that time, you have to consider they may not have a fungus infection, and you have to use an anti-inflammatory cortisone to help you with that itching. Certainly, you can try over-the-counter hydrocortisone, but as it's a very mild anti-inflammatory medicine, you may need a prescription cortisone to help you with an inflammatory condition.
How can I treat a rash at home?
If you have a rash at home, if you can identify the cause, the best way is to eliminate that cause, and your rash should go away on its own. If you have a rash and you don't know what's causing it, there's a couple things you can do to help with that rash. First of all, use a good moisturizer and take gentle care of your skin. Don't excessively shower. Don't excessively bathe. Try to keep your skin moist with a moisturizer. If you need other help, try an antihistamine or a topical steroid. And certainly, if your rash is extensive or worsening, see your doctor.
How do doctors evaluate skin rashes?
When a patient presents with a skin rash, the first thing that's important to have done is a physical examination. Your doctor can look at your skin rash and decide if it is easily diagnosable or not. Some skin rashes need blood work to accompany them to make a diagnosis. Other skin rashes will need a biopsy to help make the diagnosis, where the doctor takes a sample of the skin and sends it to a lab where a pathologist will then examine that tissue under a microscope to help make a diagnosis.
What are some possible medical treatments for skin rashes?
Your doctor can control a rash in numerous ways. The most common in dermatology is to use a topical medication to treat a rash. Other than topical medications, there are systemic medications, meaning medications we take by mouth, by injection form, or intravenous form less commonly. Moreover, oftentimes dermatologists can use ultraviolet light to treat rashes.
How soon should I see a doctor about a rash that appeared on my skin?
When you have a rash and you don't feel comfortable about that rash, you should see your doctor. There's no doubt about that. If you feel like you're wasting your doctor's time and your rash is not getting better, think again. You need to see your doctor. Generally speaking, a rash that is not getting better or worsening definitely means a trip to your doctor. If you are not feeling well, if you're having fevers or chills, nausea, vomiting, weight loss, if there's any change in your diet in any way, you should see a doctor. But if you have a rash that comes and is gone in an hour and never happens again in your life, chances are your doctor won't be able to tell you what that was either.